Hello, everyone. Thank you for joining me today. I'll be presenting a focused presentation on research that I've been doing on diabetes in India. Today, the presentation will focus on a research-informed intervention aimed at reducing the growth burden for diabetes in India. This presentation also highlights the Camaro Diabetes Prevention Program, or also known as KDP. Type 2 diabetes is a major health crisis in India. It's affecting over 77 million people and still rising. The KDPP is a community-based peer support intervention that targets adults at high risk of developing diabetes. It was developed by the C. Sharchana Institute for Medical Sciences and Technology in partnership with the Monash University and the Kerala State Leader. Participants attended group sessions led by trained community health volunteers focusing on diet, exercise, and behavior change. A random control trial of KDPP showed it was effective in improving physical activity, eating habits, and diabetes knowledge. In a current, in a cultural relevant and cost-effective way, this program is evidence-based and adaptable to similar communities across India. Here I'm showing a poster board that basically I have created throughout my research on this topic. As you can see, the featured program is the KDPP program, and the lead organization for this program is the Ministry of Health and Family Welfare in India. Um, they're a central authority responsible for health in India, and they're a good fit because they have a widespread of networking and connections throughout the country. Um, the model selected for this is the Health in All Policies, HIAP. This is a collaborative framework that integrates health considerations into policymaking across all sectors. Um, I feel like we could recommend this framework because diabetes risk is shaped by the environment people live in, like access to healthy foods, safe spaces for exercising and education. So HIAP helps bring health into areas like urban planning, school systems, agriculture, and labor policies. In a country like India, where social determinants heavily influence disease risk, this framework helps create the structural change needed to support prevention for this diabetes. Then you'll see the stakeholder table. We've mapped out 6 key stakeholder groups for implementing and scaling KDPP. These include the Ministry of Health, which would fund, oversee implementation, local governments, and which can mobilize community leaders and provide logistic support, public schools, which could include diabetes education and their curriculum, and then NGOs and health promoters who can lead peer training and track process. Each sector has a clear role and shares a goal of preventing diabetes and likely challenges that limit budgets or resistance to curriculum changes, but through coordination, these groups can work together to build sustainable prevention systems. Each um, and also, as you can see, diabetes has increased majorly in India from 2019 to 2023. Also provided is an infogram that we have done in research for preparation. Um, it's an overview of the topic. Um, it gives a lot of information on basically it's the six leading cause of death in 2019, um, sustainable developmental goals, and also some target interventions, which we are eyeing in on today, which is the KPP. Here are several references that I used in this research. And as far as the abstract, I have numbered those references. And just in case you want to go back and look and make sure and try to find some other relevant information. So I've also provided a discussion prompt. I would like for y'all, just based on giving the information and the success of the KDPP program at the community level, what are some of the most critical factors to consider when scaling this intervention into other states or countries with different cultural, economic, and policy context? And in closing, this plan supports behavior change, improved access to community care, and long-term system improvement. With the right leadership and collaboration, India has the tools and evidence to shift from treatment to prevention. Thank you all for listening. My name is Jennifer Washington again, and my contact information is jwashington44 at leomail.tamuc.edu. I am a part of the Texas A&M Commerce University, and if you have any questions, please feel free to contact me, and our team will get back to you. Thank you.